Hello all, this is Dr. Alsup, and in this video we are going to focus on the basic spatial arrangement of viscera in the pelvic cavity and the peritoneal arrangement within. So how does that inferior most extent of the parietal peritoneum actually drape over the pelvic viscera? But let's start with the arrangement of the internal pelvic viscera. And oftentimes when discussing internal pelvic viscera or identifying structures, we look at a sagittal section of the pelvis, so the internal portion of that sagittal section. Often we just refer to this as a hemisection of the pelvis. And this is a deliberate choice because it is often difficult to view all internal pelvic structures, particularly the deeper structures, from a superior view. So if you think kind of looking down into this region, you wouldn't be able to see a lot of the more inferior structures. So a hemisection is kind of key for that. So many of the BlueLink images and the illustrations that we will use are going to be in this hemisection view. The internal pelvic viscera can be divided into three major systems: the urinary, the reproductive, and associated endocrine systems, as well as, of course, the gastrointestinal system. And they are mostly organized in this same order, from anterior to posterior, with some of the reproductive organs being better described as inferior rather than intermediate in placement. So urinary system viscera tend to be more anteriorly placed, with the urinary bladder being located just posterior to the pubic symphysis. So here's the pubic symphysis on this image, and here is the bladder in both of these images. And of course, you also have those distal ureters that are going to be entering the bladder on its posterior surface. Reproductive viscera tend to be more intermediate in placement in the pelvic cavity, particularly in the case of the uterus, as well as the uterine tubes and ovaries. You can see a bit of the tube here and the ovaries here. Oftentimes, these can be described as intermediate and superior. The vagina is going to be more intermediately placed. You will also have the seminal glands, as well as the ductus deferens, or the vas deferens, that can be described as more intermediately placed. The prostate and the bulbourethral glands may be better described as more inferiorly placed, particularly in comparison to the bladder. The distal portions of the gastrointestinal system are more posteriorly placed, and this will include the distal sigmoid colon, as well as the rectum, which is going to be prominent in the pelvic cavity region, and then the anal canal will be more into this region here. So a little bit inferiorly as well, but posterior inferior for sure. Now let's discuss peritoneum, and I know you likely have had your fill of peritoneal discussions during the gastrointestinal portion of the curriculum, but it's very pertinent here as well. The parietal peritoneum will continue inferiorly into the pelvic cavity. So you can this kind of white outline right here is giving you an indication of that inferior extent into the pelvic cavity region. Now, importantly, the peritoneum does not reach the pelvic floor or the pelvic diaphragm region. Instead, it reflects onto the pelvic viscera. And those areas where peritoneum reflects from one portion of viscera to another creates what we call peritoneal pouches. And dependent on the viscera present in an individual, there will either be one pouch or two, and it is the presence of the uterus that will create two pouches. The pouch between the bladder and the uterus, so you can kind of see that extent right here, is referred to as the vesico-uterine pouch. This pouch is considerably shallower than the recto-uterine pouch, which is in this general region right here. That median portion of the recto-uterine pouch is generally considered the most inferior extent of the peritoneal cavity. And I want you to note right here the close relationship of the rectouterine pouch and the posterior vaginal fornix. So recall that recess of the vagina from where the cervix kind of moves into this region. So you have a very close relationship here with the vaginal fornix and the inferior extent of the peritoneum. And if, say, there is a pelvic abscess in the rectouterine pouch, this area can be drained through making a small incision in the posterior vaginal fornix region, and this is referred to as a coldocentesis, as you can see written here. Oops, excuse me. Now, without the presence of the uterus, there is one peritoneal pouch where the peritoneum reflects from the bladder to the rectum. And in this particular image, the bladder is very distended, so it's not typically this large. But that pouch in between the two, or kind of where that reflection occurs, is the rectovesical pouch. Here you can really see, because this is the inferior-most extent, how the inferior third of the rectum is below the peritoneum and thus referred to as subperitoneal. All right, excellent. I hope you are beginning to feel comfortable with the basic spatial relationships of the internal pelvic viscera. We will talk about each and every one of the viscera that we discussed in a bit more detail in upcoming videos, so stay tuned for those. Thank you for your time and attention here, and I hope you have a great rest of your day.